You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, he says nobody should be wearing a loose-fitting denture. He is California's go-to implant dentist. With us, we have Dr. Art Mirelez. Dr. Mirelez, welcome to the program.
Thank you, Randy. Thanks for having me here.
Now,
it's nice to be back.
You brought a stack of photos, so we're going to try to get to as many of those as possible.
I got a big stack for you today.
And you like them. They're like showing me baby pictures over there.
You know what? It's amazing what we're able to do for patients' lives.
Now, for people that don't know your practice, like who's the typical dental implant patient?
Yeah. So, at our practice focuses on dental implants. Okay. So it's the name of our practice is Revitalized Dental Implant Center. And as a result, that's what we do every single day. Okay. But there's basically two types of patients, right? It's the patient that has the failing teeth, where they've been to the dentist and they have root canals, crowns, bloody gums, bad breath, and they just know that they're in a hopeless situation. And those people, they actually feel hopeless because they think they're going to end up in a denture.
Okay.
And so, I firmly believe that nobody deserves to be in a denture. There's better solutions out there.
Okay.
And then we have the other group of patients who actually have dentures already. And those dentures are loose, they're embarrassing, they're chipping, they're breaking, they can't stay in their mouth when they have a decent meal. And so they're just looking for help, Randy.
Now, those people, you say that you could probably help the denture wearers the most, but they don't come in. Is it their fear of the dentist?
It's interesting. The average denture wearer doesn't go to the dentist, but every 16 years. And usually when they go to the dentist, it's a result of a tooth breaking off. So a lot of these patients don't know what their options are. They don't know what's possible because it's been 16 years since they've been to the dentist.
So you said that on the day of the procedure, a denture wearer, they could walk in with no teeth, walk out with upper and lower teeth that you print in the next room in one day.
Every day, all day in my practice. It's possible. Patients can come in, get their implants. We have amazing technology. I also have an in-house dental lab where we're able to print or mill their teeth literally that same day, and they can go home with teeth that are now attached to dental implants.
Now, we should mention, and people need to know, I'm not trying to side with Dr. Mirelez, but you are known all over the country in the dental field. I mean, you teach dentists. Everything we're talking about today, you teach other dentists.
Yeah, I've been blessed, Randy, really. I mean, the Lord has blessed me with the ability to teach and innovate with the technology that's available to us. We've actually come up with some amazing technology that allows us to expedite this process. In the past, it would take 10, 15, 20 appointments from the time the patient came in to the time they left with their final results. Now we're able to do it as little as 2 to 3 appointments with our technology.
So somebody watching this, if you had openings on your schedule, but if they had really bad teeth, the day after tomorrow, they could have brand new upper and lower teeth.
We do it every day.
Supported by dental implants.
We do it every day.
Is that right?
No doubt. It's possible. It is possible.
And now, does it cost more to go to a guy at the top of his game? I'll put you on the spot here.
Yeah. Actually, believe it or not, it doesn't. Because we have technology that allows us to do things better at a lower cost, more predictably. I'm here to help
because
people.
You own the lab, right?
I own the lab. Okay. So that's another reason why we're able to lower the fees in our practice, is that I'm not outsourcing it to a lab.
Okay.
We're able to control the cost, we're able to control the quality, because everything is done under one roof.
Correct me if I'm wrong here. So how dental implants are typically done here is you typically go to one doctor that does the surgery, another doctor that puts the teeth on top, and then get them maintained elsewhere. You do it right there. You do all those parts.
We do everything.
That's why it's so fast.
That's why it's so fast. Okay. And also it's very predictable, and we're controlling. I have patients that come to me and they say, I went to my first dentist. He wasn't able to help me, so he sent me to another specialist. I got a price from that specialist. That specialist said, hey, you got to go work with this other specialist that's going to make the teeth. And then by the time they're done, they have to maintain their teeth by another dentist. So they could be seeing 3 or 4 different dentists and still be lost. I have a lot of patients that come in and they said, by the time I added up all the individual treatment plans, we're talking like $40,000, $50,000, $60,000.
Because people travel to see you, is that right?
Yes, yeah. It's
from out of state?
It's very humbling. I have patients coming from all over the United States to come see me, and it's very gratifying. And the reason they come is because we have a system in place that allows them to get their teeth immediately, very predictably.
And so you're teaching this concept of getting, this, you call it a digital workflow to dentists everywhere.
Yeah, dentists from literally all over the world have come to my practice. We have dentists from Ireland, England, all across the United States come to learn the way that we make teeth for patients in a very, very simple way. And
Good.
getting to the finish line much quicker, it's a win-win for everybody involved.
How old? Like, what's your oldest patient?
My oldest patient is 92 years old.
Really?
Herb. Let me tell you about Herb. So Herb came to me and he says, this was at the consultation, and I'm telling Herb what we can do for him. And he looks at me, he says, you know, I'm mad at you. I was like, you're mad at me? What do you mean you're mad at me? He says, because what you just shared with me that as far as what is possible, I wish I would have known about this 20 years ago. And I wouldn't have been dealing with these teeth and these problems for the past 20 years. He says, you need to go out and you need to tell people that this is possible. And you know what? 92 years old, we basically rebuilt his entire mouth. He's eating and chewing vegetables, carrots, steak. He's going to, you know, the
So like
local...
new teeth supported by dental implants?
Yes. So we removed some of his teeth that were not in good condition. We place implants. We attach teeth to those implants, and he's able to eat and chew anything he wishes, you know?
So 92 is not too old for this?
Not at all. Not at all.
So when you hear a 75-year-old, do they ever say, hey, I'm too old, doc?
No, not, I mean, think about it. The average lifespan in the United States is almost 90 years old now. So I have patients coming in their 60s, 70s, and 80s, and I say, what do you want your quality of life to be like for the remaining years? You know, do you want to have to be dealing with these issues like a denture that is in a cup every night? Or would you rather just be able to wake up, brush your teeth, and have a nice breakfast?
So no more dentures?
No more dentures.
We said that at the beginning of the show.
It's not necessary, Randy. It really is
like
not
just
necessary.
new upper and lower teeth supported by implants.
All day long, I'm telling you, these patients' lives are just completely transformed. The way that they feel about themselves.
What's it like when a guy like that looks in the mirror for the first time at his new teeth?
You know what? It's a moment of tears. I would say more times than not, because we have this, we call it a reveal. And we have them turn around, look in a mirror, and for the first time, they're able to see somebody that was always there, but it was just buried, right? A lot of these patients are really reserved. And in fact, I had a quick story, Randy. I had a patient who came in with his girlfriend. And his girlfriend says, you know, he's not the same. Ever since his teeth started falling apart, he's just not the same person. You know, he used to be very outgoing. He used to take me out on dates. You know, he was very, you know, friendly with people. And he was well on his way to getting a denture. No doubt in my mind. And he knew it too. So we presented some treatment options. We always customize our treatment options to what is best for the patient at that point in time. So fast forward 3 months, we had given him a permanent set of teeth resting on implants. And he was just, his life had changed. But what was interesting about this whole situation is that his girlfriend says, you know, he's the most flirtatious guy now because he's got the confidence. He's talking to everybody. And she's saying it jokingly, but to me, that was like, that's pretty amazing. You know, that guy that she knew prior to having these horrible teeth is back, you know? And she's like, I got to calm him down because he's talking to all the girls all the time.
Now, does that happen young or old? Like they kind of return back to where they used to be?
You know, it does. And when patients come in, they're always very reserved. They're withdrawn. They're embarrassed. They're ashamed. And one thing I tell them is I said, listen, I promise you, what we're not going to do at this practice is we're not going to make you feel embarrassed. We're not going to make you feel ashamed. We're here to help you. And the only time we're going to ask about your past is so I can have a better understanding of what we need to do to give you a brighter future.
Okay.
Right? And
That's
so
nice.
when I do that, you know, a lot of this reservation and guilt just kind of goes away. And now they know that we're here to help them.
Can you see the end result? Like you're on a consult,
Yeah.
you're hearing their sad story,
I do.
but you're in your mind, you're going, boy, this is going to be good. Does that ever happen? Like where you go, this is going to be good?
It happens every time. Okay. Every time I look at the patient and I can literally imagine what that smile is going to look like. And I always ask, I said, how do you think this is going to make you feel when it's all said and done with? And they visualize it. And it's amazing. I just ask that simple question, how do you think this is going to make you feel when this is said and done with? And they're just like, oh my gosh, I'm going to feel amazing. I'm going to be able to eat. I'm going to be able to present myself.
So
I'm going to be able to get a new
excited
job, right? A lot of these people can't. I had a 22-year-old come in. He was unable to get a job because every other tooth was missing. 22 years old, right? We fixed him up in literally a day. He now has a job like that, just because the fact that he
It's
can
more of an
smile.
internal confidence.
It is.
Is that right?
It is. But also, listen, I mean, think about this, Randy. If you have candidate A and candidate B, they're equally qualified. One has a beautiful smile and one you can't stand to look at. Who are you going to hire?
Okay, it's fair.
Right?
Yeah.
And so I think the teeth really present a lot of confidence in individuals when, you know, they can smile with confidence.
And you say their smiles get bigger over time. What does that mean?
Well, you know, these patients, they have not been accustomed to smiling. They don't know what it feels to smile. So when we first give them the smile, they're kind of like a little hesitant, you know? And then we see them every month or so. And by the third or fourth month, I mean, their lips are touching their eyeballs, you know? It's just a radiant smile. When you have unhealthy teeth, it affects your entire immune system. So if you are a diabetic, or if you have high blood pressure, or you have high cholesterol, any of those things, if you have bad teeth attached to them, those diseases are exacerbated. They get worse.
Because of the infection in the gums.
Because of the infection that you have in your gums.
If you have bad gums, like gum disease, can you do this?
Randy, that's what we see. Yes, Randy, those are the people that are coming to us. So the answer is absolutely yes. If you have gum disease, this is the solution.
So you clean up their gums.
Clean up the gums, their bacterial infection goes away, and now their mouth is much more healthier, and as a result, their entire body's more healthier.
Okay. Now we have to bring this up. How much they are. Dental insurance doesn't really cover it.
Right.
Medicare, Medicaid doesn't
But
cover
Randy,
it.
hold on. That's absolutely true. But we have payment options. Right?
Okay.
These patients finance, and now something that wasn't possible before financing, they're stretching those payments out over 5 or 6 years, and now they're able to change their life now, right? And as a result, make those payments that are much more feasible than coming up with the amount right up front.
And you have to have some credit.
Yeah,
to
you
get
have
this done.
yes, definitely.
Because you're not carrying it yourself.
We're not carrying it ourselves, but a lot of these patients, they have co-signers that come in to help facilitate
That's nice.
this transaction. So yeah, and I would say the majority of our patients come in and are making payments.
We're out of time.
Okay.
Now, what if let's say people are watching this. They've seen you on TV, let's say for many years. It's been like 7 years.
Yeah, yeah.
And they're either wearing a denture or headed to a denture. They've heard what you have to say, but they're still skeptical. What's your advice for them?
Come in and see us.
Okay.
Come in and see us and give us an opportunity to just change your life. Have an improved life that's going to allow you to just continue to give back. And this is the other thing that I found is that a lot of patients, they start thinking, I'm not worth it, right? And a lot of these patients are patients that are providers for other people in their family. They've taken care of their kids, they've taken care of their spouses, they're taking care of their parents. And I look at them and I say, I think it's your turn. It's your turn to do something so you can continue caring for these people. And when they start to realize that, they look at me and they say, you're absolutely right. You know, I said, when was the last time you did something special and nice for yourself?
That's good.
Yeah. So, you know, it's amazing to be able to transform these patients' lives. And I'm blessed. I'm really blessed to be able to do this here in Fresno, Clovis, California. You know,
good for you.
Yeah. So thank you. Thanks for having me on here, Randy.
Now, if somebody wants to make an appointment, they just go online, make an appointment there, or call you. What do you prefer?
They could do both, but we prefer that you give us a call, only because we're going to be able to give you more details.
Okay.
So just give us a call and we'll get you all set up.
All right. I want to thank you for coming on the show. Good stuff.
Thank you, Randy. I appreciate that.
You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.